Hi all, I just wanted to do a quick video for you to help you better prepare for the first lab practical. So I want to show you some resources as well as to show you kind of basically what to expect for the first lab practical. And that way, hopefully this will help you in terms of directing you towards your studying so that that studying can be more productive. So as you can see, you've already been here for all the Practical1 information. And when you actually go to take the practical next week, you will go ahead and click on this link. And I'll talk more about that as we get closer to the practical, but please remember that this will need to be taken in Respondus, lockdown browser and monitor. If you have not already downloaded that app, and then taken the practice quiz to ensure that everything is working properly, please go ahead and do that this weekend. That way then we can just ensure that we've worked out all of the kinks, and that way then you won't have that extra stress during the actual practical about the program that you're taking the exam in. I want you to feel comfortable with that program so that way then you can really focus your attention on the content at hand, because that's enough, right? So when you have gone to each of these sections, each of these labs, you'll see that at the bottom we have both soft chalk labeling activities as well as the StudyMate flashcards. Hopefully you've already worked through these soft chalk activities, labeling activities. They're a drag and drop program. I know I've showed them to you before, but please use those if you have not already done so. And then for your actual studying for the practical, use these StudyMate flashcards. And again, you can download this app. I know I did this in the announcement. I gave you some instructions on how to download the app onto your mobile device so you can access these flashcards from your mobile device. Wherever you are this week, you can just really work through studying these flashcards. And so I will tell you that most of the questions on the exam for the microscopy portion, there are a few content ones, but most of them will be, what is this structure? Just like this. Name the specific part of the microscope the arrow is pointing to. And so here you would say objective lens, or 5x objective lens, or scanning objective lens. Okay, so these are a great resource again for you to be able to just go through and really quiz yourself on these different parts to the microscope, as well as some of the content on the microscope itself. You should understand how to calculate the total magnification as well, if we were to give you a question on that, based on the objective lens, again, times the ocular lens. So this is really handy again for you to be able to use this tool for studying for the microscopy lab. So again, you can just be able to flip the card and go, okay, this is the fine focusing, this is the coarse focusing knob, and each one you can just go through and label those parts. So hopefully this will really help you in terms of going through and testing yourself on those different parts of the lab. So again, I'm just going to kind of go through the different labs. I really think that it's most beneficial for you at this point. Hopefully you have already gone through most of the labs. You might not be all the way through the skin lab because that technically is next week. But you'll see, especially in the mitosis lab and the histology lab, there are quite a few slides. So again, these StudyMate flashcards should really help you in terms of looking at these different slides and different structures, telling what phase of mitosis each of these slides are in. So again, you know, if you have questions about this, like you're like, well, why is this prophase? So remember that here in prophase versus interphase, in interphase, you're not going to really see chromosomes yet. But in prophase, you'll actually see chromosomes that are condensing. They'll look kind of like basically like dots at this magnification, right? But you should see some dark purple in there. And that's due to that, again, those chromosomes condensing in preparation for mitosis. So if you have questions like that as you're going through this, please ask me those questions, and I am happy to help you out, because sometimes I'm just not sure where the confusion is on certain slides. So please feel free to email me, and I can even, if you want, make you a special video if you're really struggling with some slides. I can always give you some hints on how to master those slides. I think the ones that you will want to spend kind of the biggest chunk of time with are going to be these histology slides. And these histology slides, again, are pretty intense. So as you're going through each of these, and you're going to click on epithelial tissue. And you will see down here, again, we have StudyMate flashcards that were created for each of these to really help you with dealing with these structures. So here it says name the specific tissue at the tip of the pointer. You should be able to tell that this is transitional epithelium. So, and the way that you can know that, again, is by some of those tools, like looking for those really kind of bubbly cells at the surface and then a little more elongated in the center. Usually transitional epithelium will look to be about 7 cell layers thick. So again, there's just all of these nice tricks to the trade. If you are needing some of these tricks, please email me if you don't feel like you got enough out of the actual lab. So again, some of them are going to ask for the general tissue type. So when you're asking for the general tissue type, you're looking for like epithelial tissue, connective tissue, nervous tissue, muscle tissue. And then some of them will ask for the specific, and that's what you saw here. You're looking for the very specific tissue type. So here it says, so if it said general tissue, you would have just marked epithelial tissue. But here, because it's asking for the specific tissue, then you would mark transitional epithelium. So, and then you may have some that ask for the structure. So again, here it's pointing to the basement membrane. Remember that you'll have a basement membrane on these epithelial tissues. And then same here, you're going to have specific structures. So here it's asking for the specific cell, which is the goblet cell. So just to kind of help you, this really will help you with the types of questions that you're going to get in the actual practical. So those StudyMate flashcards should be very helpful for you. Again, I really want to encourage you to be able to download that to your mobile device, so that way then you can test yourself wherever you are. Now, lastly, I think this is handy more so, again, for giving you an idea of the setup for the practical. Please keep in mind that these sorry, I'm not even on the right practical here, but please keep in mind that these practicals are not necessarily the exact same questions that you're going to get, right, on the practical. So they're practical-like questions, but the idea of the practical is to give you an idea of the format for the practical, okay? Again, this is a practical only. It is not meant to substitute studying for each of the individual sections, because if you just study this practical, you are not likely to do well on the practical, because you need to know the content in each of these labs. So, but if you do, I did go ahead and open this up for you so that you can preview it. And the reason I did that for this weekend is mainly so that you can see what the practical is going to look like. So here this says name the specific tissue. So here this is adipose tissue, and you would actually type in adipose tissue. Okay, so I want you to have an idea of what this practical is going to be like. It's not multiple choice, so I like to give you that. I like to give you that heads up. So here again, this would be name the specific tissue. So here you should recognize that this is the dense irregular connective tissue. So here you would write in dense irregular connective tissue. Oops, if I can type properly. Oh, sorry guys, I'm off there on my, there we go. If I can type properly. Now, it is important to understand that spelling does count, but let's say you did that. Let's say you just did what I just did and you accidentally did that and you, so normally again, if you make some type of like typo error, I will take off usually, not only usually for like if you're misspelled more than one letter, I should say here, I would take off just 1 point. Or in this case, I would probably only take off a half a point because you got dense irregular connective. So that's the majority of the kind of content for it. So if you just messed up the last part, I would probably only take half a point off. But now, obviously here, if you put dense regular connective tissue, that's a whole different tissue, and that would be incorrect. But let's say you did dense irregular, and maybe you just spelled irregular like this, okay? Then usually for one misspelling, one letter off like that, I don't take off, okay? So just to kind of give you an idea as to how I'm going to grade, usually for one letter off, I usually don't take any points off. 2 or 3 letters off, I'll take anywhere from half a point to a point, depending on, again, how important it is to the actual overall name. So again, you know, if you messed up tissue but got dense irregular connective, that's the most important part, right? So again, those are the types of things that we're looking for in the practicals. So again, hopefully this just gives you an idea of what to expect. This is the practice practical is really a great way for you to kind of get accustomed to the format, and that way then you won't be so shell-shocked when you get to that first lab practical. Please, I would love if you guys would send me some emails. I'm going to send out an announcement. And for those of you, what I would like to do, because it's so difficult for us to do review sessions, because you all have different time frames, I have different time frames. So what I'm going to do is I'm going to have you all write in your questions, and then I'm going to make a video based on the questions to answer all of your questions. And that will be basically my review session for the practical. So please write in questions. If you are really confused on how to identify transitional epithelium from stratified squamous, I don't know, I'm just making these up, but please write in those types of questions for me, and I will walk you through the slides and how to identify the differences in them. I just don't want to go through everything because obviously that would be far too long, and then you guys really wouldn't take the time to listen to it. So please, please, please send me those questions, and I would be happy to put together a video for you guys, basically as a review. All right? Okay, thank you very much.